most workers only have access to 3 days of accrued sick time. And so, in the midst of this coronavirus pandemic, when our public health authorities and doctors are saying at a minimum that those who may be experiencing symptoms or near folks who had been confirmed to have the virus need to quarantine for 14 days and self-isolate, it's just not nearly enough. And so really it puts a lot of workers who are now our communities are depending on with a difficult challenge of, do they continue to go to work to be able to feed their family, or do they protect their own health and the health of their community? So that's really why we've been focusing on trying to provide as many workers as possible access to the paid sick days they need.
And what about the recently passed federal law, the Families First Coronavirus Response Act? Where are the gaps there? Who isn't covered?
So the good thing about the federal law is that it allows for all employers with fewer than 50 employees to seek fully refundable federal tax credits for any dollars they spend on providing paid sick leave. The problem is that it leaves an enormous gap. And it says, for large employers with more than 500 employees, they don't have to do anything when it comes to providing sick days to their workers. And so companies like McDonald's or Whole Foods, or a lot of these essential companies that are still operating, aren't providing their workers with the paid sick days they need.
There was a group of San Jose council members, right? They were working on a paid sick leave plan back in March. What are the differences between what they originally proposed and what was voted on Wednesday?
Yeah, so initially, when we were working with council members Esparza, Arenas, and Carrasco, the hope was to get both a long-term policy. San Jose is one of the 4 largest cities in California, the only one that doesn't have a long-term paid sick leave policy to give workers more sick days than the state minimum allows, and to cover all workers with 14 days of paid sick leave in the event of an emergency.
Over the weekend, I had a chance to chat with San Jose Councilmember Magdalena Carrasco. She's been vital in the push to get a comprehensive paid sick leave policy in place for San Jose workers. Here's a portion of that conversation.
This policy is good for everybody. The policy that allows you to stay home and take care of yourself when you're not feeling well, when we're in the middle of a pandemic, with one of the viruses that we know is incredibly contagious and has a greater fatality rate than what we've seen with other viruses, then that also puts everyone that they come in contact with at risk. If you're showing up sick, they're handling your food, they're handing it to you through the drive-through, you've now potentially been exposed because that individual did not have any sort of ability to take that time off and still get paid. We have the local taquerias who are still serving food and sending burritos home when our door dashers show up to their place. So we wanted to make sure that they were covered. And then we also wanted to make sure that those people who are allowing us to stay in place were covered because they were not being covered under the state mandate.
What are you hearing from small businesses? Those who have fewer than 50, right? 50 employees. What has been their reaction to this? Are they all hands on deck? We'll get support from the federal government and see it through, or are they worried?
So of course they're worried. I think everybody is just in this state of disbelief and uncertainty. We don't know what kind of real help we're going to get that's really tangible. That's why at the local level, you have to make sure that you are getting policies through that reinforce or strengthen whatever is already in place, and make sure that whatever assistance, financial assistance especially, is coming through, that it gets to our people very quickly. So again, I'll say we're not perfect. Our policies may not be ideal. They're meant to allow people to stay home, to stay safe, to stay healthy, and also not to continue spreading the virus. We must make sure that our most vulnerable are safe and that they survive this, and it's going to be up to us.
Councilmember Carrasco, thank you so much for taking the time out today to talk with us. I really appreciate it.